May I come in?
Sure.
Alright. Hey, Mr. Fleury it is, right? How you doing?
How you doing?
Alright, I'm Nurse Jean. I'm going to be taking care of you for the day. So I'm here to do your vital signs, and I'm going to do a head-to-toe assessment on you, alright? A complete head-to-toe. Should take me about maybe roughly 20 minutes or so. Alright, just give me a second here. Alright. Alright, Mr. Fleury, check your wristband here. Can you state your name for me? First and last name. Alright, and your date of birth?
1/2/1980.
Alright, Jamal, do you know where we're at right now?
Yeah, at the hospital.
We're at the hospital. Okay, Jamal, do you know who's the current president of the United States?
Yeah, Joe Biden.
Joe Biden, that's right. Alright. So now I can see that my patient is alert and oriented, ×4. You know where he's at. Alright, Jamal, let me get over here and do your vital signs. Okay, so the first thing I'm going to do here today, Jamal, is I'm going to check your temperature. Alright, just to see. Now, Jamal, have you had anything to drink, any coffee within the last half an hour or anything? No, that's good. That's good, Jamal. That's good. And what brought you in today?
No, I just needed a checkup.
Regular, okay. Routine checkup. That's good, you know. At that age, put that just underneath your tongue, right back there. Sorry about that. An accurate reading on here, Jamal. Keep that going there. I'm just gonna sit here and assess your pulse. Do you have any kids or anything, Jamal?
Mm-hmm.
Check your heart rate here, okay?
Oh.
Wait for this to get to this 0. That's good, you know. Yeah, your heart rate was 65. Here, your temperature is 98.6, so that's good. Alright. Alright, Jamal. So next thing I'm going to do, Jamal, is I'm going to check your blood pressure, okay? Alright. Oh, by the way, Jamal, I'm sorry, I forgot to ask you. Are you having any pain?
No pain at all.
No pain at all? So you sure you're any? On a scale of 1 to 10, what would you rate your pain?
0.
0? That's good. That's good.
Besides women, that's the only pain.
Believe me, brother, we all got them. We all got those problems, man. We all do. Let's get this arm right up here for me now. Alright, so I'm just going to put this cup on you, alright? Let me just see here. Let me feel for your brachial artery.
Watch the guns.
You work out?
Natural.
Can I feel your brachial artery right here? So I'm gonna go about 2 inches above that. Get this blood pressure going. Get it nice and tight there. Big fella like you, I don't know the wrong reading, you know.
Yeah.
Get that there, Jamal. This baby right here. Alright, so now I'm gonna check your blood pressure, okay? Sorry about that. This was open. Didn't notice that, but I just saw that now. We'll start over, alright? So now what I'm doing, Jamal, I'm just checking your blood pressure. I'm just checking your systolic pressure and your diastolic pressure. Alright, so what I'm gonna do here, I'm gonna reflate this systolic reading, so I'm gonna pump you back up, Jamel. Then I'll get a more accurate reading of what's going on here. Now I'm gonna listen to it with this.
It's not working.
Alright, your mind is good. The blood pressure is 124 over 76. Alright, that's awesome, dude. You know, right there. So now, Jamel, just gonna have you breathe for me normally. Just take some deep breath, you know, just normal as you would breathe. Alright, I'm just gonna count here. About 30 seconds, I'm gonna check your respiration, right? Okay? Go ahead, breathe in. Alright, Jamel, that's good. Your respiration rate was a 12. Alright, so now I'm gonna inspect your head, alright? I'm gonna move on to the next one here, Jamel. So let me see here, Jamel. So now, Jamel, I'm just gonna inspect your head, see if anything I can see out of the ordinary, Jamel. Your head looks straight, it looks symmetrical. Doesn't look like you have any lumps or anything there. And the hair is braided. You know, I'm gonna put these gloves on and, you know, just get a more feeling to see what's going on. I'm gonna check to see if you have any lumps, any dentures, you know, any infestation in there, you know, any lice, any bald spots, you know, like alopecia. Nice braids, man. And the ladies keep you tight, I see.
This lady frizz my hair.
It's symmetrical. Eyes. Okay, eyes look like they fit the head. Your head looks like it's your body size. Yeah, that's good. That's good. Hold that right there. Alright, test your cranial nerve 7, which is your first nerve. So what I want you to do for me is just close your eyes, squeeze. Okay, that's good, Jamel. Can you smile for me? Can you frown for me? Alright, Jamel, can you pop out your cheeks for me? Good. As I can see that all your cranial nerve 7, you know, they're all intact, which is a good thing. So now next I'm gonna just feel your temporal arteries here and just measure the pulse.
Alright.
Which is good. About a 2+. You know, you got a strong pulse there. And then from there, I'm just gonna make my way down and I'm gonna check your cranial nerve number 5, which is your trigeminal nerve. All right, Mr. Fleury, can I just have you bite down for me? Bite down your teeth, bite down. All right, feel the masseter muscle here. Okay, it doesn't look like it's swollen. Feel your temporal muscle. Doesn't look like it's swollen. All right, Mr. Fleury, can I just have you try to open your mouth against resistance for me? Okay, he can open his mouth, but I mean that it's intact. Alright, and I'm just gonna hear, can you just open your mouth and close it for me? Okay, I don't hear any clicking, any crackling sounds. Okay, so that means his trigeminal nerve is intact. Alright, Mr. Fleury, now I'm gonna check your sinuses, okay? I'm just gonna press down on them lightly, just let me know if you feel any pain or anything. Alright, I'm gonna check your maxillary sinus. Feel anything there?
No.
I'm gonna check your frontal sinus. Feel anything there?
No.
All right, that's good. All right, so now next, Mr. Fleury, I'm just gonna check out your eyes, okay? I'm just gonna look at them here. For me, they look pretty good. Okay, it looks symmetrical. Your pupils look equal. Pupils look like they're about a 3. Nice. Okay, your sclera looks good. All right, let me see here. Okay, I don't see any jaundice. Okay. All right, any conjunctiva. Don't see anything. All right, Mr. Fleury. Now I'm just gonna have a look here. Okay. Alright, let me see here, your eyelids, they look good. Alright. I'm just gonna pull down your eyelids real quick, okay? I'm gonna check for any conjunctiva. I don't see anything. The sclera looks good. Alright, Mr. Fleury, that's good there. Alright, so now, Mr. Fleury, what I'm gonna do while I'm here is I'm gonna check your cranial nerve 3, 4, and 6, which is your oculomotor, the trochlear, and your abducens, okay? So the first thing I'm going to do, Mr. Fleury, is I'm going to check for any involuntary movement of your eye. It's something called nystagmus. Okay, so the first thing I'm going to do here, Mr. Fleury, is I'm going to hold this pen right here about 12 inches away from me, okay? And I'm going to perform the 6 cardinal field of gaze, all right? So I don't want you to move your head. I just want you to follow the pen with your eyes for me, okay? All right. Alright, now I didn't see any involuntary movement of your eyes. It looked good there. That's good, Mr. Fleury. The next thing I'm going to do here, Mr. Fleury, is I'm going to come here and I'm going to check your pupils. Okay, I'm going to come in from the side. I'm just going to check your pupils to make sure that they are reactive to light, okay? See here, they should constrict. Just look straight for me, Mr. Fleury. Look straight for me. Okay, yes, his pupils do constrict. Both of them did, so that means his pupils they were round, they reacted to light. All right, just look straight for me, Mr. Fleury. I want your pupils to dilate, so just look straight for me. Look straight ahead for me. Yes. Okay. Now I notice both your pupils, they reacted and they constrict. So what I'm gonna do is I'm gonna trim this light here for a little bit, Mr. Fleury. I just want you to stare out in the distance from me because I want your pupils to dilate. Okay. And I'm gonna perform this next test here. Let's see if we can get this bad boy just dim just a little bit here. All right, Mr. Fleury, stare for me into the distance for about 5 to 10 seconds. Just stare for me. All right. Now what I'm going to do is I'm going to bring this pen close to your nose and I just want you to follow it as I bring it to your nose. Just follow it. Slowly. Okay. Good. 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 Okay, Mr. Fleury, that's good. So now I'm going to document this as PERLA, which basically means that your pupils are equal, they're round, they're reactive to light and accommodation. Alright, Mr. Fleury, so what we're going to do next, Mr. Fleury, is I'm going to check your cranial nerve number 2, which is your optic nerve, alright? So, Mr. Fleury, I would just like you to stand up for me real quick, please. Alright, thank you, Mr. Fleury. What I would like you to do is now just cover your right eye for me. I'm going to cover my left eye, okay? We want to make sure that we're covering the eye in the same direction. Alright, Mr. Fleury, can you tell me how many fingers am I holding up now, Mr. Fleury? Okay, that's good, Mr. Fleury. Now, don't look at my hand. How many fingers am I holding up, Mr. Fleury? That's good, that's good. Now we're going to alternate eyes, Mr. Fleury. Just cover this eyes for me. How many fingers am I holding up, Mr. Fleury? 2. That's good, Mr. Fleury. Now look at my hand. And how many fingers am I holding up? 2. That's good, Mr. Fleury, that's good. All right. We can see here that your peripheral vision is good, Mr. Fleury. I'm just going to have you read some letters for me over here at my Snellen chart. All right, Mr. Fleury. So now, Mr. Fleury, what I'm going to do is I'm going to test for your visual acuity. All right, so what we have here is the Snellen chart. I have you standing about 10 feet here because it's a small one, so so that in the reality is about 20 feet. Just tell me what's the lowest line there that you can read, Mr. Fleury, if you can look for me.
Second and last one.
Second line. Can you repeat for me what those letters are?
D-E-F-P-O-T-E-C.
D, E, F, P, O, T. Good, Mr. Fleury. So as we can see here, you repeated line A, which is the 20/20 vision line. So based on the Snellen chart, you have 20/20 vision with your visual acuity. That's good, brother. What I'm going to do here is I'm going to inspect your ears. All right, so I'm just going to look here, see if we see any redness here, any drainage. Have you been having any drainage from the ear, Mr. Fleury? No.
Saw my girlfriend this year.
I feel you, brother. I feel you, man. Me too, trust me. We all got those problems. All right, Mr. Fleury, so I'm just going to touch your ears here. Let me know. Do you feel any pain?
Nope.
Any tenderness or anything?
Nope.
All right. Now, I don't have an otoscope with me, but if I did, I would check his tympanic membrane. It should be a pearly gray color. You know, I look for the cone of light, you know, also. But so what I'm going to do here, Mr. Fleury, I'm just going to check your cranial nerve number 8, which is your vestibulocochlear nerve. All right. I'm just going to check for your hearing to see how that is there. All right. All right. So I'm just going to close this ear here, Mr. Fleury, and I'm going to whisper something here to this side as I lean. Just tell me if you hear what I said.
Cat dog.
All right, that's good, Mr. Fleury. That's good, Mr. Fleury. I'm just gonna do the same thing with this ear, and I'm gonna go here.
Yellow red.
That's good, Mr. Fleury. So now we can see that your cranial nerve number 8 is intact. All right, that's good, Mr. Fleury. So what we're gonna do here is I'm gonna move on to your nose. Just gonna inspect your nose here. Just look at it. Make sure that it's midline to your face. I don't see any abnormalities. You ever been having any drainage from the nose?
Nope.
No, not at all. All right. Let me just check in here. Look at the septum. See what we got here. I don't see any drainage coming from the septum or anything. All right, Mr. Fleury, that looks good. So what I'm going to do here, Mr. Fleury, just going to feel your nose. Let me know if you feel any pain. Any pain here?
Nope.
Anything?
Nope.
All right, Mr. Fleury, what I'm going to have you do is just close one nose for me and blow out the other. Okay, any pain, anything? All right, do the other one for me. All right, that's good, Mr. Fleury. So what I'm going to do here, Mr. Fleury, I'm going to check your cranial nerve number 1, which is your olfactory nerve. All right, just going to check your sense of smell. I got this peppermint smell here, then I got this Vicks smell here, Mr. Fleury. Just tell me if you can look at me straight, and you can just tell me if you can recognize which is what, okay?
Yeah, that's the peppermint.
All right, that's good, Mr. Fleury. What's this?
That's the Vicks.
That's the Vicks, all right. And what's this?
The peppermint.
All right, that's good. All right, we got a strong sense of smell here, Mr. Fleury. That's good. That's good, brother. So now, Mr. Fleury, as I mentioned, we noticed that your cranial nerve number 1 is intact, which is your olfactory nerve. But that's a good thing here, all right, Mr. Fleury. So now what I'm going to do is I'm going to get some gloves on here, Mr. Fleury. I'm going to just check your mouth real quick. See what we got going on over there. How many kids do you have, man?
Two.
Two? Alright, boys or girls?
A boy and a girl.
Boy and a girl, how old are they?
They're 14 and 9.
Alright, let me just say here, Mr. Fleury. Just have you open your mouth for me, Mr. Fleury. I'm just gonna look around in here, see if I see anything out of the ordinary. See it, Mr. Fleury. Check your lips. I'm checking his lips, his upper lip. I don't see any crackness, any red. It's not blue, which would be a sign that, you know, he's low on oxygen. You know, it's nice and moist, so that's good. Mr. Fleury, do me a favor. Can you stick out your tongue for me and move it around? Okay, that's good, that's good. So now, Mr. Fleury, we can tell that your cranial nerve number 12 is intact, which is your hypoglossal nerve. That's a good thing here. Open up for me. Let me just check here. Let me check the cheeks.
My girlfriend likes number 12.
She likes number 12? Oh, man, that's good. Mr. Fleury, you're a comedian. I like that about my patients. All right, check the cheeks here. They look nice, Mr. Fleury. Let me see here. Let me check your hard palate, your soft palate. That's good. All right, here. Check underneath your tongue for any lesions or anything. It's good here. You don't look like you have it. I do notice a couple of cavities. You didn't mention that to me. All right, Mr. Fleury, let's look at here. Okay, I see the uvula. I can see it's nice and hanging. Mr. Fleury, can you say ah for me? All right, that's good. You see that uvula go up and down here. Now what I'm gonna do, Mr. Fleur, is I'm just gonna touch back there a little, you know, just to see your gag reflex. That's good, that's good. So we know the gag reflex is intact. Okay. Now, Mr. Fleury, as I just checked, we can tell that your cranial nerve number 9, which is your glossopharyngeal nerve, is intact. All right, and then we can also tell that your cranial nerve number 10 is intact, which is your vagus nerve.
Awesome.
Now we can do that because you're able to talk to me without any hoarseness and you're able to swallow. All right. So now, Mr. Fleury, what we're gonna do, Mr. Fleury, is I'm just gonna go on here and I'm gonna move to your neck. All right. I just want to inspect your neck here, Mr. Fleury. Look at it. I don't see anything swollen. You know, any deviation. You know, it's symmetrical. That's a good thing here, Mr. Fleury. I just look around here. Alright, so what I'm going to do here, Mr. Fleury, I'm just going to palpate your neck here. Just let me know if you feel any pain. Anything? No?
No.
Alright. Alright. You just have you lean your head, tip your head back for me. Look here, check the trachea. You know, his thyroid, make sure he doesn't have any swollen thyroid, which is called a goiter. You know, it doesn't look like he has anything here. Trachea looks like it's midline there. It's good, Mr. Fleury. You don't have any pain here, Mr. Fleury. Alright, that's good. So what I'm going to do now, Mr. Fleury, is I'm going to check your cranial nerve number 11, okay? Which is your spinal accessory nerve, alright? So what I'm going to do is I'm just going to have you turn your head for me side to side like this and let me know, do you feel any pain? Are you able to do that? Okay, so that's good there. I'm going to do is I'm going to press down on your shoulders and I want you to shrug for me against resistance, okay? Can you shrug for me? That's good. That's good. Shrug for me. That's good. So now that we know that your cranial nerve 11, your spinal accessory nerve is intact. All right, Mr. Fleury, so what I'm going to do here, Mr. Fleury, I'm just going to have you lean back for me a little, just like at a 45-degree angle. Just turn your head to the side for me. What I'm going to do here, I'm going to look for your jugular distension vein, just to make sure that that's present here. Okay, I can see it here. It's nice, you know, and showy. All right, that's good here, Mr. Fleury. Check that there. Now, Mr. Fleury, what I'm going to do is I'm just going to feel for your lymph nodes, okay? Make sure that we don't have any fluid built up there, you know, any tenderness. So as I go there, just let me know if you feel any pain or anything. All right, Mr. Fleury? And now I'm going to check you. This is your preauricular. Feel any pain there or anything? Alright. I'm going to check your postauricular. Feel anything?
No.
Alright. That's good, Mr. Fleury. I'm going to do it. I'm going to check your occipital. You feel anything here? That's good, Mr. Fleury. Next here, I'm going to check your parotid. You feel anything, Mr. Fleury? No, nothing?
No.
Okay, next thing, Mr. Fleury, I'm going to check your jugular digastric. You feel anything here?
No.
Alright, that's good. And then not any tenderness. I'm going to check your postmandibular. You feel anything here?
No.
Alright. I'm going to check your submental nose. Do you feel anything here? Any tenderness, anything?
No.
Alright. I'm going to check your superficial cervicular. You feel anything here?
No.
Alright, we're gonna make our way down to the deep cervical chain. Do you feel anything here?
No.
Okay, that's good. Don't feel any lumps or anything there. Now your posterior cervical right here. Do you feel anything? Any pain, any tenderness?
No.
Alright. And right on top of the clavicle, we have the supraclavicular node. Let's see here. Anything? No? Alright, that's good. So nothing here, as we can see, as we can feel, looks good, Mr. Fleury. All right. What I'm going to do from here, Mr. Fleury, I'm going to just move on and check your upper extremities. All right. Listen to your heart sounds and your lung sounds. All right, Mr. Fleury. So now what we're going to do is we're going to inspect your upper extremities. I'm just going to look around here, see if I see any signs of any lesions, any abnormalities, anything swollen, any redness. So far, I don't see anything, Mr. Fleury. Okay, everything looks good. Okay, just check your pulse here real quick, brother. That's good, that's good. So I checked his radial pulse. It's about a +2, which is good, Mr. Fleury. I like that, that's good. While I'm there, let me just check your brachial. Let me see what that is. Okay, so that's also a 2. That's also a 2. Alright, I like that. That's also a 2. Now, Mr. Flair, what I'm going to do is I just want to check the range of your elbow. Matter of fact, I can just do this one. I just want to check it. Check for any signs of crepitus, which is basically your bones rubbing against each other. I'm just going to move them up and down here, see if I feel anything. Okay, nice and smooth. We don't see anything. I don't feel anything here. It's nice and smooth. That's good. Mr. Flair, now what I want you to do is, I want you to have you stand up for me. Alright? Just hold your hands out for me like this, Mr. Flair. Close your eyes. I'm going to count to 10. And what I'm checking for is see if you had any recent strokes, any sign of strokes or anything. Then I would watch one arm go up the eye, it would drift. But if it doesn't, then he's good. It looks good, Mr. Flair. It looks good. So have a seat for me. Have a seat for me. Alright, have a seat for me, Mr. Flair. Alright, everything looks good, Mr. Flair. So what I'm going to do now, Mr. Flair, is I want to... Oh, I'm sorry, Mr. Flair. Alright. Let me check here 1 second. Just check your hands, fingers. What I'm going to do is I'm going to snap your finger here a little bit. I'm going to watch the blood flow. But what this is called is the capillary refill. I just want to see how quick that it goes back, okay? That's good, that's good. About 2 seconds, which is good. Now, let me just see here. Skin turgor is good. Skin goes right back. Okay, that's good, Mr. Flair. All right, let's see here. Let me just listen to those heart sounds real quick. See what we got going up here, Mr. Flair. All right, so what I want you to do, Mr. Flair, for me is you're going to take a deep breath, okay? And you're going to hold it, all right? Yeah. I'm just going to listen to your heart sounds, okay, Mr. Flair? All right. What I'm going to do here is I'm going to start at the aortic, and then we're going to move to the pulmonary. All right? See here? I want you to take a deep breath for me and breathe and hold it, okay? Same thing for me. Take a deep breath and hold it. Here at the herbs point, take a deep breath from me and hold it. Okay, that's good. Breathe for me, Mr. Flair. Now I'm going to check your tricuspid valve. Take a deep breath from me and hold it. That's good. That's good. And here, Mr. Flair, I'm going to check your mitral valve. Take a deep breath for me. Hold it. Okay, Mr. Flair. Breathe for me, Mr. Flair. I'm going to sit here, Mr. Flair. I'm going to sit and I'm going to count your apical pulse. Basically, I'm going to sit here for about a minute and just try to get your pulse rate from there, okay? Be patient for me and just breathe, all right? Okay, amen. All right, Mr. Flair, your apical pulse was 72. Normal pulse is between 60 to 100, so that's good. All right, so what I'm going to do now, Mr. Flair, here. I'm gonna listen to your lungs, okay? Alright, let's see here. I'm gonna start at the apex of your lungs, okay? Do the same thing for me. I just want you to breathe and I want you to hold it, okay? Breathe for me, hold it. Okay, breathe for me. Okay. Now what I'm gonna do is, I'm gonna find the sternum and make my way to the angle of Lewis and go right here to the second intercostal space and listen here. Breathe for me. This is the right upper lobe of the lung. I'm going to listen to your left upper lobe of the lung. Breathe for me. Now I'm going to listen to the right middle lobe of the lung and the left upper lobe. Breathe for me, Mr. Flurry, and hold it. Upper lobe, breathe for me, Mr. Flurry, and hold it. Alright. And now, I'm going to listen to your right lower lobe. You breathe for me and hold it, Mr. Flurry. Listen to your left lower lobe. You breathe for me and hold it, Mr. Flurry. Good, that's good, that's good. All right, I'm gonna check your lungs from the back, Mr. Flurry. All right, just gonna have you stand up for me. Good reading here. Pretty tall guy. All right, I'm just gonna start at the apex, just as I did from the front, okay? All right, see here. Breathe for me, hold it. Good. Breathe for me and hold it. Okay, from here, just tilt your head forward for me a little bit. You want to find the ball right here, which is C7. I'm going to make my way down to T3, which is right in between the muscles. Right. So what I'm going to do is I'm just going to auscultate it here and listen. All right, Mr. Flurry? Breathe for me. All right, breathe for me. All right. And then from here, I'm just gonna make my way down smoothly from T3 to T10 and listen to your lungs, all right? So just breathe for me. Breathe. 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 Breathe for me. That's good, Mr. Flurry. Your lungs sound great, man. Your lungs sound great. Your heart sounds great. That's good, Mr. Flurry. So what I'm going to do here, before I forget, Mr. Flurry, I actually just want to listen to your heart here with the bell so I can hear if you have any murmurs or anything going on there, all right? All right, so let me just check here, Mr. Flurry. I'm going to check your aortic here. Listening for any swooshing sounds, any brewy sounds, you know. Hold it. Good. Breathe for me and hold it. Good. Nice sound. Reverse point. Breathe for me and hold it. Nice. I'm gonna go over here to your tricuspid valve. Breathe for me and hold it. Good, good. I'm going to go over here to your mitral valve. Breathe for me and hold it. Everything sounds good, Mr. Flurry. Everything sounds good. Alright. Stop here. So now the next thing we're going to do, Mr. Flurry, I'm going to assess your muscle strength in your upper extremities. All right, Mr. Flurry, so what I want you to do for me is just squeeze my fingers here with both your hands as tight as you can. All right, go ahead and squeeze them. All right. You can let go now. You can let go now. Yeah. Okay, that's measured about +5 right there. Okay, that's good. So now if I can just have you cross your arms right here for me. I'm gonna push against them. I just want you to push back against them. Okay? All right, strong man. So that's definitely a +5 right there. All right, Mr. Fleury. So next thing I'm going to do is I'm going to just inspect your abdomen. All right. So when I'm looking here, looking at the contour of the abdomen, okay, he pretty much has a flat abdomen, you know, okay. See here, I don't see any lesions, any wounds. Looking at the belly button, I don't see any hernia there, Mr. Fleury. That's good. Are you having any abdomen pain?
No.
When was your last bowel movement?
Mm-hmm.
Not sure. Okay, you have any problems when you urinate? Any pain?
No.
No? Okay, Mr. Fleury. No, we don't see any drainage from the belly button here. Alright, so what I'm going to do, guys, I'm going to auscultate. I'm going to listen to the quadrants of the abdomen. What I'm going to do is I'm going to start off with the right lower quadrant and just listen here. I'm going to make my way clockwise. I'm going to listen to the right upper quadrant. I'm going to go here to the left upper quadrant. And I'm going to make my way here to the left lower quadrant. Nice sounds. I don't hear any obstruction in there. That's good. That's good. Okay, next, guys, what I'm going to do is I'm going to switch. Okay, Mr. Fleury, next thing I'm going to do is just going to switch my stethoscope over here to the bell side, and I'm going to listen to some vascular sounds in here, okay? All right. See what we got here. Now I'm going to listen to the aortic artery, which is right here. Listen here. Okay, nice and good. From the aortic artery, I want to listen to the left renal artery, which is about right here. Nice and good. Now I want to listen to your right renal artery, which is right here. Sounds good. Then I want to listen to your right iliac artery, which is right here. Right below the belly button there. And I also want to listen to your left iliac artery, which is right here below the belly button. No obstructions. Nice and smooth. Everything sounds good, Mr. Fleury. Alright. I know you're not full of you know what, because I don't hear anything in there. Alright. Let's see here. So now what I'm going to do, Mr. Fleury, I'm just going to palpate your stomach, alright? Just let me know if you feel any pain or anything there, okay? I'm going to start off with a light palpation. And then from there, I'm going to move on. I'm going to do more of a deep palpation, okay? Alright. So I'm just going to feel here. Let me know if you feel any pain when I do this. Any tenderness. I don't feel anything hard, any lumps, anything swollen. Alright, now what I'm going to do is I'm going to do a deeper palpation, okay? About now, do you feel anything? Any tenderness, any pain from your stomach? Okay. There's some belly sounds there. Okay, that's good, that's good. This is why we do not palpate before we auscultate during the stomach. So yeah, guys, so whenever we examine the stomach, we're going to switch it up. Instead of inspecting, palpating, percussing, and osculating like we normally do, we're going to switch it around because of the stomach. We're going to inspect, we're going to osculate, we're going to percuss, and palpate. And the reason for that is because I don't want to mess up his bowel sounds. You know, if I palpate it first and then I listen, get it all moving in there, you know, and then it's gonna sound pretty rough in there. All right. So from there, what we're gonna do is examine and inspect your lower extremities. All right. So what we want to do here, guys, we just want to examine your lower extremities, make sure they have nice coloration. I don't see any swelling on there, any abnormalities. We want to check the patient's feet, see if I see any gout. Check under his feet, see if I see any diabetic ulcers. Sometimes, a lot of times when you have patients that are diabetic, bottom of their feet will have some ulcers. I don't really see anything there, so I'm going to put on my gloves and, you know, have a closer look. All right, Mr. Fleury? All right. Almost done here, Mr. Fleury. You want to get home to that beautiful girlfriend of yours? Get you up out of here, man.
She's been texting me saying it's taking too long.
You should be discharged out of the hospital soon, so just come in here, Mr. Fleury. So let's just have a look. First thing I want to do, Mr. Fleury, I'm gonna feel your popliteal pulse, okay?
All right. Get them popliteals.
Oh yeah, them popliteals, man. That's good. Nice and strong. Your pulse is back here. It's +2. That's good. Mr. Fleury, what I'm gonna do is just gonna press on your tibia to see if there's any edema present. A lot of times, if there's any edema in the leg, you press on the tibia, you can kind of see it move or or scatter. Let's check this one here. Check this foot. Okay, nothing so far. Nothing. What I'm gonna do, guys, I'm gonna make my way down here to the posterior tibial pulse. I'm gonna feel both of them and see what the strength is here. Nice pulse right here. Definitely a +2. And now I'm gonna check your dorsalis pedis pulse, okay? All right, which is right on top of here. Nice, Mr. Fleury, nice. Wow, man. Usually we have to get a Doppler to feel these right here, but these are nice and strong, man. I like it, nice and strong. Okay, from here, I'm just gonna check out your toes, Mr. Fleury, make sure everything is okay with that. All right, we don't see any nail fungus. I don't see any grout or anything like that. All right, so what I'm gonna do, Mr. Fleury, I'm gonna check the capillary refills as I did with your fingers in your hand. Just gonna snap this nail back here and see how quickly the blood goes back. Okay, nice. 2 seconds. It's good right there. Yeah, Mr. Fleury. Oh yeah. Nice and strong, Mr. Fleury. Nice and strong, Mr. Fleury. Okay. Alright, Mr. Fleury. Okay, good. Alright, Mr. Fleury. Now, next thing I'm gonna do, Mr. Fleury, is I'm gonna check your Bourbon reflex. Pause real quick, Barbara. Oh my God. Next, Mr. Fleury, what I'm gonna do here, Mr. Fleury, just gonna use my finger to kind of go around the shape of your leg here in a circle, all right? I'm checking your Babinski reflex, all right? Now, if there's normal and it's negative, what should happen is that your toes should curl in, okay? Let's see here. Let me just check here, Mr. Fleury. Okay, see how those toes curl in, so that means it's good. Okay, you're negative, don't have anything going there. That's good, Mr. Fleury. Alright, so Mr. Fleury, what I'm going to do now, Mr. Fleury, is I'm just going to check your strength of your lower extremities. What I'm going to do is I'm going to have you push up for me. Nice. Alright, it's good. It's about +5 right there. Now I'm just going to have you lift your legs up for me against resistance. Nice. And you lift the other one for me. Nice, Mr. Fleury. That's about a +5 right there. All right, Mr. Fleury, that has wrapped up your head-to-toe assessment. Nice to see you, brother, and I'll see you next time.
All right.